Good morning, Dr. Matteo Basso. It's very good to have you on the podcast, All Pulp No Fiction podcast. How are you doing today?
Very good, very good. I'm fine, and I'm super happy of being on this podcast. I heard about a lot of time, and now being part is even. I'm very proud of this.
Thank you, thank you. We are actually very, very proud and very happy to have you here. Obviously, last time I met you, you were here in Japan for the 100th anniversary of GC, and we got to visit Kyoto also. So it's been a little while since I met you. It's very nice to talk to you again.
Yeah, it was a very wonderful experience for me. It was very good to be there at this event because it was a huge event, and to share what is my experience and my reality. And but what I had the possibility to bite and to taste of Japan, of this beautiful country, was really incredible. Even thanks to a very precious guide I had that is in front of me now.
Yeah, the pleasure was mine, really. It was really nice. Uh, so you talked about, your reality and that, obviously when you visited us, you talked about digital dentistry. So before we get into that, can you talk to me about your background and what got you interested in this field?
Yeah, with pleasure.
Yeah.
While describing me, I always tell, even during congresses, that I am a clinical dentist. So this is the proper description. I worked in university since 2001, and even before during my courses. But I'm not that kind of university person strictly inside the research. I'm doing
Mhm.
a lot of that, and I have many colleagues that are even very good in making this kind of extraordinary researches. But I always describe myself like a clinical dentist. And you know me, and even many colleagues around the world know me like a minimal invasive dentist. So when they read my curriculum,
Mhm.
generally they are quite surprised that I start from periodontology, then with a PhD in implant dentistry and surgeries, and then I also have a specialty in oral surgery. So there is this big contrast in between the minimal invasive and my background. Like
Mhm.
this was the question about maximal invasive therapies.
Mhm.
This was really a big part of my life, of my professional life, because really I believe that this helped me in knowing the world of dentistry. But then I realized that whatever is even maximal invasive was anyway connected by a big word, that a big description of dentistry, that is even the part of the minimal invasive dentistry or the minimum intervention dentistry. So this was the reason why I created in the university in 2007 a different department that is called minimal invasive and restorative. This is a translation from Italian: minimal
Yeah.
invasive and restorative oral rehabilitation department. This means
Mm.
that I was trying already to connect what is minimal invasive and the big part of the restorative dentistry that could seem really maximal invasive, especially the old procedure, but then it's strictly connected. To preserve the tissues is anyway crossing through all these kind of specialties of dentistry. Is then from 2012, 2013, having the possibility to work with very prototypes of machines, even during my university study, that I added the digital part, because anyway, digital dentistry is something that is strictly connected not only to prosthesis, to dental prosthesis, but even to many other specialties. I would say all specialties, because you can really use them.
Mhm.
But the background, as you saw, is like a long journey into this kind of specialties. And now I can define myself a digital minimal invasive dentist.
Okay. So in your opinion, in the way you see it, So what is digital dentistry? Like you said, like it's not just about prosthetics, right? It
Yeah.
involves different fields of dentistry. So in your opinion, how do you define digital dentistry?
Yeah, this is the question. I mean, this is a very, very, very
Mm,
good question
mm,
because what you said is correct. I mean, many are thinking that digital dentist is prosthesis, is making a crown with a scanner, but digital dentist is can be defined right now dentistry because there is no dentistry anymore without a digital part. And even if you don't know, you are already working with digital dentists. So this is the reality of what happens now in the world. Digital dentist, if we want to go inside the pure definition, is something that we can perform through the aid of computers or artificial intelligence. I saw a very interesting podcast episode with Falk Schwendike speaking about this.
yeah,
But on the other side, we are digital dentistry is the dentistry we are working now. There is no possibility for us to work without, and this is a very important statement. And even if we have not a pure digital devices, we can say intraoral scanner in our clinic, all the world, the dental world around us, first of all, our dental technician cannot work without digital dentistry. So this is something that is already inside our profession. Then I can decide if I could be more digital or less digital, but we are already working this. So if I had to give a pure definition of digital dentistry, is something that now is dentistry, is the world of dentistry. No way to work without.
I see. I was about to ask you about it. Like, how is the world of dentistry is getting affected by digital dentistry? But you already said it. It's affecting everything. Like, there is no modern dentistry without digital dentistry, right?
Yeah, I strongly believe this. I really can appreciate from big exhibitions, from the pure congresses that we can find every day on the web or physically, luckily after so many years.
Mm,
But everything is affected. On the other side, even the big push of the industry is going in this direction. There are the biggest efforts, even economical efforts of the clinics are anyway interested and put in this kind of field. In any case, I'm running both my department in clinic and university, but even a private clinic. So when I start using this kind of new life, when I started this new reality, I could really feel in deep what is the impact, even in private dentistry, in private dentistry, on private clinics of digital dentistry. I give you an example. Digital dentistry is anyway providing us tools, is providing us devices, but on the other side, I like to say that digital dentistry is providing the dentist new opportunities. If I making this example, if I decide to continue anyway to use amalgams, now are extremely under discussion, and in many countries it is not prohibited to use, and they work very well. Like dentists, I can see them every day performing, still there. Sometimes we we replace, but they are not the up-to-date material, and I can continue to use them, but there are many other opportunities. Then we have composite. You are the masters of this research of composite in your company and the many other materials. And the state of the art of aesthetic is composite. But there are plenty of new opportunities starting from materials, lutein cement, many materials with mechanical behavior that conventional material cannot work, that are provided only by digital dentistry. So I believe that dentists should consider that if they decide anyway to not to look at this digital dentist, like yours is, or anyway to be slow, or anyway to avoid the investment in this kind of field. They are deciding for their patient not to use maybe up-to-date materials or material that can be really much more performing than what we are using today. I'm not telling that whatever is not digital dentistry is like amalgam. No, this is must be clear. Everything works very well. I like to do the old analog dentistry, maybe not so back to amalgam, but the old dentistry, and with very good results for me and the patient. But I really believe we have not the pure right to decide in the name of patient not to use material that can perform very well in the mouth.
I see. So something that you just mentioned, that old dentistry or like traditional dentistry that doesn't use digital dentistry, there are uses of it. So in your opinion, where is the line? Like, is there a clear line where digital dentistry takes over, or like it's still kind of very connected? And what is our role as dental professionals in trying to learn this technology and trying to incorporate it in our daily work?
Well, it's the digital dentistry now can perform technically and even theoretically sometimes very well, and can take over what is this famous line you cited. This take over this conventional actual dentistry that, like I told you before, is still very good. The problem is anyway that we have a wide world of devices, a wide world of technologies, a wide world of materials even, and not all of them can perform in the same way. I believe that many situations are still under investigation. There are huge improvements where even like with the cell phones, the old cell phone maybe can perform well, but the new one always adds something new. Being anyway mainly a prosthetic dentistry where precision is anyway the top line and the final goal of our daily work. I believe that anyway for starting and for anyway creating a good workflow, the dentist should focus on what is the key, on anyway what is considered the starting point of being digital in a clinical reality. So having an intraoral scanner, this is anyway the choice that many dentists see like the edge between the past and the future. And the choice of buying and invest money in a scanner, it's something that is like in the market is growing up. There are these kind of digital societies I'm also part of that are anyway attracting more and more dentists. And this means that many more and more dentists not only have the interest, but they already invested. They decided to grow in this. And dentists, like company anyway, I always make the example of the composite. I believe that many dentists using a composite with success are not really interested in changing this because they don't know what they find. They don't know if a new brand can perform as well. They don't want to restart learning. This is a very big wall in between the changes in dentistry. But if I see that many dentists are anyway investing in this technology, they decided anyway to become more digital, is not just because they want to invest their money in something that is like a fashion. It's because they can see the results. They can see the precision. They can see that the procedure is anyway taking over this old path that they were performing before. So the dentists are telling us anyway that this world is ready, and this world is anyway interesting. I'm giving you just another little example. Maybe I'm taking a lot of time, but
no, please go ahead. Yeah.
It's something even that I remember in my events. I'm always telling this. I had the possibilities when I was at the university to work with a very nice colleague that at the real beginning was working with this kind of chair-side machine. If I have to describe this machine we had in the university at that time, is really like to describe our actual cell phone and the cell phones on the 80s, no, with the cell phone and then the cabin and then the battery and then something else that you have to put somewhere.
Yeah.
But believe me, it was interesting. I was young. You know that young people are much more willing to try this technology. I owned this technology before, but at that time, what I was really ready to produce was not something today I would describe like quality based. It was something I adapted. It was a fashion. It was super modern, but not ready. And dentists, of course, you can imagine from 90s and even 10 years ago, dentists perfectly knew this. So now I believe that with this line, this taking over already arrived, and many dentists realized maybe it's a lack of communication of anyway of trust in machines, or because they had maybe an experience in previous ages, in previous years, where machines were not ready, still blocking a huge transformation. That is anyway happening.
I see. So you mentioned that many of the dentists that like work with composites, so basically direct restorations, having an intraoral scanner is kind of the wall that they jump over in order to move into digital dentistry. So in your opinion, does introducing digital dentistry, that means that indirect restorations are going to take over direct restorations?
Well, it is a matter of workflow, and the workflow is a matter of organization. So I really believe, and looking around even to big reality, like could be a university. My clinic is not so small, but anyway, there are even bigger clinic. All the clinics that are investing or that want to grow have to invest anyway in digital dentistry, because the workflow of indirect restoration is anyway really predictable, is anyway opening a wide world of materials that I cannot use basically directly. So I must stick to few group of materials, maybe a big group of material if I consider a dental catalog, but then this kind of materials are always the same. There are just clones of them or quality difference, but those are what I have to consider. The indirect restoration are opening a wide world of possibilities, and the workflow can be very, very fast. So I believe that anyway, once you can decide to have a chair-side procedure, but as the same, you can decide even to have an indirect process, so sending you to the technician. And thanks to the world, we have the dental technician, because they can provide us a lot of possibilities more than what is only chair-side. I believe that's anyway the workflow, like this was your question, will take over anyway these realities. We will still use our abilities with the hands, because our is like an artisanal job, so we have to perform. The quality is still strictly related to the dentist, to the dental job, is still strictly related to the quality of the dental technician's job. So this is something that I always repeat. That anyway, digital dentistry will not cancel dentists and will not cancel dental technicians, but the indirect workflow that like I told you, had the possibility to test in the 90s and even in the past decades is not that one. It's something that really is predictable and is anyway taking over many of the direct restoration.
So you mentioned that you in the 90s, like you were young, you were willing to be adventurous, you wanted to try new technology. So, and even though it was not so developed back then, you still gave it a go. So, in your opinion, how do you motivate, at least younger
Yeah.
generations to try and actually learn these new technologies, especially for, let's say, like not so old people, but not so young, because like really young dentists, they're probably already taking courses about digital dentistry. Let's say about people who graduated before the introduction of digital dentistry in curriculums, but they're not, so old that they just think that this is not the way to go. So how, mm, in other words, what are the merits that you think that will convince dentists who did not move to digital dentistry to move to digital dentistry?
This is something that is many companies are asking themselves just to to put their products anyway on the edge. But this is even a question that during the congresses is very popular. I would do like a separation in the group of people and dentists that are facing and anyway put their interest in digital dentistry. Young dentists, and I had many every year because I have students. That students they become young dentists. They really, you can appreciate. They really start with a different appeal, with a different approach to these technologies. And I'm a little sad to say that in several cases, I have some student that's know details more than me, that I'm working in dentistry. I started in 2000, not like the age of graduation, but they know much more details, even in the software, because the softwares are these machines that are kept very simple. I see the big efforts for companies to keep they are very usable, but at the end, like in a very good dental photographical machines, you have 100 functions, and sometimes you continue to use the usual 3 functions, no, because that's it.
Yeah.
And that's enough is something that anyway is keeping the old aged or middle-aged dentists to refrain a little bit to this. Keep in mind that these dentists are even those maybe facing at the same time when they were young, like during university, that kind of system that I also resigned to use. So this is even maybe something on experience. But I believe that the big effort that has been done is to put something in the hand of the dentist that works and works in a simple way. And this is something that really I can appreciate. I'm, as you perfectly know, I'm developing even a new scanner, and even the scanners existing on the market, even the most famous one from decades, they were not at all easy to use. They were sold, they were on the market, but many dentists using them, they saw the investment big, and they saw the difficulties big.
Mm-hmm.
Now, of course, the rules are changed. And what I can really appreciate, the merit and the big effort that works, is that anyway the machines are made simple, are usable, are predictable, and even this kind of middle-aged dentists and older, we can say, but without taking anyway. I don't want to blame on anybody. It's just to my same attitude, because I put myself in the middle age dentist. So the attitude is anyway to continue to do what is simple, what works, what the patient can appreciate, and I don't want to put in the mouth of my patient something I don't know and I'm not very expert in using. So this is anyway something that should be even implemented, but is arriving. It's to keep it easy, to keep it usable, to keep it immediate. And it is something that normally I can see young dentists are really anyway are willing to use, are really prone to put time over there, to invest, to know, to keep their knowledge deep inside the machine they are using, and to use this at best. Unfortunately, as you perfectly know, young dentists are those with the less possibility to invest, and maybe aged dentists are those with the possibility to invest, but they didn't trust. But I believe that this kind of world that are quite distant are now, even because the young dentists are anyway getting older and older, and they now matching together, they are merging, they are joining, and this is something that will happen. I really found usability like a big barrier for joining dentistry, and just to make you another quick example of this kind of change I can really appreciate while lecturing in this kind of the field. At the beginning, the majority of the dentists, interested dentists, were very young because technology, because of the interest or something they saw during the university. Nowadays, the majority of the dentists, or almost the totality of the dentists approaching these rooms or these events or this hands-on training are all these kind of dentists that want to change their usual working, successful dentistry into something they feel they need. And this is what I feel. They feel before like an investment, like buying a good car, or a good car with a powerful engine that is anyway fun, but not really needed. Now they see this like something I must have, because probably I cannot work without. And the technician is telling me, Matteo Basso is telling me every time, Akram is telling me on the postcard, this is what. So this is what I believe is the automatic engine that cannot stop.
I see. Also, based on what you just said, I'm just wondering, like, it's not easy to take this step, right? Especially there's plenty of information out there, right? The word digital transformation keeps, thrown everywhere. Digital transformation of this, transformation of that. The episode with Professor Falk-Schwindeke, and we talked about AI in dentistry. So this might feel a little bit of a unknown world for people who are not really kept up to date with this information. So how do people kind of lower the obstacle of getting information so that they would know how to access this information? That, as you say, people who think, first of all, this is an expensive car that I don't need, end up thinking, no, this is something that I need and that's going to help me in my practice. So in your opinion, what can be done in this area?
Well, this is the barrier, and anyway, the idea that buying a new machine is not like buying a car, like we use the same example. So I was able to drive before, I will be able to drive even now. This is the reality of thinking. This is not right properly that, but on the opposite side is like I'm now willing to buy this machine, but I need to restart learning. So this is what happened. This is the main obstacle they have. Secondly, I like to repeat this example when Marco Ferrari joined me Marco Ferrari is a professor in the University of Siena that is very, very active in the digital dentistry. He joined me in a meeting where I also had some colleagues. One of them was my students now is even lecturing in digital dentistry. He was showing this big concept of the digital patient. You can digitalize everything. You told before, digitalization is everywhere. We can create our small crown, but with digital dentistry, we can have the whole body of our patient digitalized, in the clinic. And this is called even digital patient. You can match 3D X-ray technology. Falk spoke about this. You can work on them. You can see the 3D mouth inside the body of the patient. So looking even how changes can affect the soft tissues. And there is this big race in showing the wide potential of digital dentistry. Well, Marco Ferrari told a very a very wise and a very smart sentence while commenting with my colleague that was my student, that up to now, dentists, while looking in a congress, while reading on a journal, this wide concept, very complex concept of digitalization of patient, of having specialized room to digitalize even the last air we have in the mouth, in the mouth, yes, in the head. Well, me and you are not so rich, but anyway, we can digitalize
For me,
everything.
It's gone.
yeah, it's but anyway, we are not like we were 20 years ago. This is the meaning, but we are anyway successful in our field. Anyway, when the dentists see this, Marco Ferrari said they see that there is like a big river in the middle, so a big obstacle in the middle, because anyway, this is not the dentistry we are now looking at. The digital patient is a potentiality, is a possibility, but it's not that. So to make this easy, we have to anyway to make the people able to try, to use, because really, believe me, what I was using 5 years ago is not the same feedback of what I'm using now. What I'm using now, even machines we are developing now, are really easy to use. And really, when the dentist can see that, for example, an intraoral scanner can get a super performant impression in less time than a conventional silicone that still have maybe some fields, but anyway can be used, can be anyway left instead of using a digital scanner, they will immediately appreciate. So digitalization is not that you need to change your mind and to digitalize your patient and to digitalize the body, or you have to then to buy the machines, the super extra modern machines. You can, but you can treat the patient in a different way with a different workflow. When the dentist will understand this, and they can understand that the digital scanner is an investment that, in the opposite of what is anyway believed, can even last years. Another big barrier is that, like with the cell phone, we buy a machine now and in 3 years we need to change it. This is not true. I'm still using old scanners, but maybe there are more performant ones, but we can use it. They will start implementing the concept that anyway buying a scanner and anyway sending the things to the dental technician real time, having a smooth workflow, reducing mistakes, because the dental technician, believe me, will tell you, finally I got something overpassing our usual defects. Okay, you will have this positive push. I'm really convinced that anyway, and this is a message for the dentist, that being digital, and I repeat this all the time, being digital or anyway investing on a digital scanner, that, as we told, is our first step, needs anyway a digital technician. So the technician is even a big important part to invest, and is anyway even the final step that anyway, when the dentist is more or less convinced to invest in digital dentistry, is convinced by his dental technician, because the dental technician now 100% will say invest, because this technology is something we need, like a team. So we need this technology. If you want to invest, please invest. Then we have anyway not digitalized dental technician. I told you before, nowadays this they cannot do. Dentists still can, but the dental technician cannot do. So they even must change. Maybe some traditional technician is still working without this, and is not that one convincing the dentist. But I'm really, if I have to give a suggestion, please, dentist, speak with your dental technician, share the information, and try the machines. You will get your information, you will overpass all the walls or the rivers or the broken bridges that you can find, because using this machine is amazing, predictable, and successful for you and for the dental technician.
So From what I'm understanding, you're saying that the key is first the dental technician. So if the dental technician starts motivating dentists to move into digital dentistry, the response might be faster than, by themselves trying to go into digital dentistry, right?
Yeah, you should even consider that the problem of the scanners, and working in this world since many years, and as you can imagine, we try different models. I was looking back at what was my feedback to these machines, and one of these was always, my technician is not happy. My technician cannot work on this. So many dentists even would resign to buy. They resigned because the dental technician was not able to provide a good crown. That on the other side, the same technician was able to provide with a conventional impression. So this was the barrier. Now the technician, anyway, gets the conventional impression, digitalize it, and anyway gets a digitalized impression. So it's easy for him to compare. This is old path that needs one day just to get the digitalized model, and this is the full digital path, so the intraoral scan. And it matches. Okay, this is one day more of work and cleaning and putting and working, and this is immediate. Okay, but they are usable, they are similar. So the technician will say,
why would I waste more time on this, right?
That's it. And another thing, sorry for interrupting you and taking this time. I decided in this new clinic yet not to invest in a pure chair side. I was working this for years in another clinic, but then with this kind of speed of workflow, if the technician is as well organized, I can send anyway this 3D impression, and after agreement, I can receive this framework in the same day, in few hours. So even the chair side can be overpassed, not at the same level, not at the same speed, but digitalization allow me to work chair side with patient arriving from abroad even in the same day. So digitalization is working in different manners.
So yeah, obviously, like I think digital workflow is much faster. Like you said, like the transformation of information is definitely a lot faster than doing it manually. I think just one more question. I know I've taken a lot from your time today, but just
I'm here for you. Don't worry.
Thank you very much. Like you said, like some dentists, like you said, like you still use some devices, some intraoral scanners from years ago. And this kind of reminded me of when somebody wants to buy a new PC and they just wait for the better specs to come out so that they would buy the better specs. But every year, better specs are going to come out, right? So what do you say for people who are still waiting for something better to come out? Like how do you tell them no, but the devices that we have here are still going to work for years to come, right?
Yeah, I mean that nowadays, even because digital dentistry became a hot topic in dentistry, and we can find it everywhere, exhibition and dental congresses is anyway everywhere. The competition in between companies doesn't allow companies to put products or prototypes or something that cannot work. I agree with colleagues that in the past they were buying machines with compromises, so something better was always on the way to come. That now we can do this, but probably in 1 or 2 years we will have a new machine with new possibilities. So this was the feeling. I'm investing a lot of money in something that anyway, even the sales force is telling me that it will go out quite early with a new machine with new efforts. If I have to say now, with machine of years ago, we already arrived to what is the quality we need in many fields. Then the development I can appreciate is not purely hardware right now. We have very good scanners, but the battle is moved in the software, and what the software is allowing me to obtain. Software, for giving you an example, are those that after the scanning are anyway post-processing the image. So the image that the technician is working on is not just the pure scanning, it's something the software is originating. So the machine is already good. The quality they are anyway giving to me is sufficient. What I even got in a little bit older machines still using is an update of the software. And like you can perfectly imagine, like it happens with our operative system in the computers. They updated in the software doesn't mean that I need to change the machine or the computer. But I agree with you. In the past, the idea of buying a scanner was exactly the same. I'm buying something now that is a compromise, and anyway, not the best of the best, but I need the best of the best, so I will need to change.
Yeah.
Now I have a very good machine, giving me the possibility to get the best from me, from my impression, for the technician, and I can work on them for years. And the battle will be, of course, on the software. And the battle in between companies will be even in the machine. But one thing is to feel the need to change the machine in 1 year. One thing is to change the machine when I already use it for 3, 4 years, 5 years, and they want to change maybe because this is even economically convenient. We do it even with a dental chair. So this was faster to be changed before in respect to other devices. Now is becoming like all other devices I have in my clinic. I'm changing even the digital X-rays machines because it's a choice. So that's it.
Yeah, I see. Thank you very much, Doctor. It was very informational. Thank you for, informing us about digital dentistry and about how to understand how to invest and why to invest in it.
Yeah.
Yeah. Okay.
It's never. I would really even like to give you a few words. It is never a bad investment.
I mean, honestly, the way if somebody is following, the news of dentistry and the updates, like it's clear that the future is digital, right?
Yeah.
So I don't think it would be a bad investment, and obviously the more educated people become about it, the more that they will understand how to utilize this technology to better their practice and benefit their patients even more, right?
Yeah. And I would add even that nowadays the patient knows that digital dentists exist. So they will look at you. Even this is one of the engines, for buying machines. But have you got these cameras or not? And they say, no, I've not, because I saw, or my friend said, this is even now something that make you in a little bit dark shadow. But it's future, but it's really actual future.
So anyway, so thank you very much, Professor Basso. This was very informational. I am looking forward to having you again on the podcast. So for people who are interested in asking a bit more about the technology, is it okay if we link information to you so that they can ask you about it?
Super okay.
Yeah. Okay,
I really always happy if somebody is writing me.
Okay, perfect then. Thank you very much, Professor.
Thank you, Akram. It was a pleasure.